Hello, my name is Eve, and today we will be talking about head migraines and cluster headaches. Okay, so a migraine is a neurovascular disorder that causes unilateral, one-sided throbbing head pain that lasts for 4 to 72 hours. They can it can proceed first with an aura like flashing lights, visual disturbances, and then the migraine happens. It's said it's caused by activation of cranial nerve 5 and cerebral arterial vasodilation. So cranial nerve 5 deals with your face, and so they're saying that triggering that cranial nerve is what's going to cause that head pain. Yes. So it leads to vasodilation. So that makes sense. If your vessels are dilated in the brain, it won't be getting there appropriately. So this can cause some pain. If cells aren't getting blood, it can cause pain. So the medications that they're going to give you for your migraine headaches is going to cause vasoconstriction. And some of those medicines are ergotamine, sumatriptan, sumatriptan, subtriptan. It's like that, something like that. You can drink caffeine, you can take NSAIDs, prophylactic medications like antihypertensives and anticonvulsants. Antiemetics, because you can have some nausea and vomiting here. Okay. Risk factors, family history, and if you're a woman, but this can happen to anybody, it's just most common in women. Triggers that would cause a migraine to happen would be like bright or flashing lights, stress, anxiety, menstrual cycle, sleep disturbances, and certain foods with MSG or timing, like old cheese and old wine and things like that. What you want to teach these patients is to lay down in a dark room and avoid triggers. So no stressings, none of those things that would cause your headache. Avoid those. Symptoms for a migraine: throbbing head pain that's unilateral on one side, nausea, vomiting, photophobia, you don't want to see light, you're very sensitive to it, phonophobia, which is noise. You're sensitive to noise, it makes it worse. And you'll have auras, like flashing lights before the headache comes on. Drinking coffee can help with migraines because it causes vasoconstriction. Then we have cluster headaches and they're very different from your migraines. Migraines happen for like 4 to 72 hours. There's a phase there. With cluster headaches, which is a neurovascular disorder that causes unilateral and non-throbbing head pain that lasts for 30 minutes to 2 hours. So in cluster headaches, there's no throbbing, it's just hurting. And the difference between cluster is that it happens at the same time of day for months, and it's common in the spring and fall. It happens around the orbital region where your eyes are. So you're going to have some tearing there. You could have some swelling. They say the cause for cluster headaches is there's a sudden release of histamine or serotonin at cranial nerve 5, which is your trigeminal nerve, deals with your face. You can have nasal congestion here, facial swelling, droopy eyes that can have excess tearing. We talked about that. There can be some agitation, pacing, because there's pain, but it's not throbbing, but it's still pain. Treatment for cluster headaches will be your ergotamine, Sumeptrin, oxygen therapy, corticosteroids, and verapamil, which is a calcium channel blocker. So the difference between migraines can involve nausea and vomiting. Cluster is just the pain, and it happens the same time every day for months. So that's why I say it's cluster, because it's gonna keep happening. Okay, so this wraps up migraines and cluster headaches. Thank you.